COVID-19 cases around the nation continue to drop, but for some, they can now get some extra protection if they choose. Here's ABC's Rena Roy.
Americans over 50 can now get a second booster shot, with the FDA authorizing the fourth dose Tuesday morning. The CDC also signing off.
The FDA believes that this option will help save lives and prevent severe outcomes among our highest risk patients.
Federal health officials are offering this fourth shot, but not formally recommending it, instead leaving it up to people to make their own decisions based on health, risk, and age.
It's important to have a conversation with your provider about your personal risk, your past medical history, to understand the benefit of an additional dose.
Dr. Anthony Fauci saying regular booster shots could eventually become the norm in an interview with the BBC.
I would not be surprised, even though there's no guarantee, that we would require an intermittent boosting somewhat similar to what we see about the requirement of a flu shot each year.
Next week, the FDA will consider a second booster shot for all Americans and a potential variant-specific booster, though experts say most vaccinated and boosted people are still well protected. The 7-day COVID death average here in the U.S. now at its lowest since last August, with just below 700 virus-related deaths reported each day. But some areas of the U.S. are seeing a rise in new COVID cases, with BA2, the subvariant of Omicron, now estimated to be the dominant variant across the country. In New York, New Jersey, and New England, BA2 is believed to be responsible for more than 70% of new cases. On the West Coast, about 60%. Those numbers are probably much higher, with many new cases likely being undercounted. Federal health officials say reported test numbers have dropped 75% since the beginning of the year. Rena Roy, ABC News, New York.